So first, I would like to invite you, Dr. Mohammed.
Good afternoon, all. I am Dr. Aderonke Mohammed, and I'm presenting on behalf of my colleagues, Professor Olugbenga Ayodeji Mokolu and Professor Olayemi Adewumi. And thank you for coming. So I am going to be talking on health status of farming households and crop productivity, evidence from malaria-infected households in Nigeria. Malaria is actually endemic in Nigeria, and it affects majorly the impoverished, malnourished, and most vulnerable within the population. The question is, does malaria really impact badly on crop productivity or not? Agricultural development is worsened by malaria impact on farming households, and most studies on the impact on malaria has been largely inferential. The most important, what interests me most about this study is that we are actually testing malaria, and it is not based on inferential. It is actually tested to actually ascertain if malaria actually have effects on crop productivity or not. So this study determined the effect of malaria on crop productivity in a longitudinal cohort of farming households in the study area, and the study was carried out for over a period of 8 months, following the same households and testing for malaria to actually ascertain in reality that malaria actually affects them, and that is why they are not able to attend to their farming activities. And specifically, the study determined the incidence of malaria in the local government area, compared crop productivity among households based on malaria incidence, identified the determinants of malaria incidence among farming households, and assessed the intensity and the determinant of welfare loss among malaria-affected households. So the study was carried out in Kababunu local government area of Kogi State, central Nigeria, and 72 households were used for the study. Malaria test was actually carried out using rapid diagnostic test kit among 432 household members. Following the malaria test, the number of days they were not able to attend to their farm was documented. Also, we documented the cost of prevention, cost of caregiving, and cost of treatment. And also, monthly visit was carried out in order to document their farming activities on their farm. Following the malaria test, we looked at the households, and if the household is having malaria or complained about malaria a week before, we tested them to make sure that we get a substance called antigen that is present in their blood. And if that substance is present, they have malaria. Otherwise, there is no malaria. And so we analyzed this data using descriptive statistics, inferential statistics, such as the ordinary least square, binary logistic regression model, and we found out that using the descriptive statistics, we're able to look at the cropping pattern in the households and also look at the protective measures against malaria. And results shows that households practice both monocropping and intercropping, with 5 crops documented, such as the maize, millet, bambara nut, sorghum, and cowpea. Results shows that 80% of the households cultivated maize as sold, 40% cultivated millet as sold, about 19.4% cultivated bambara nut as sold, and maize was intercropped with sorghum, that is at 4.7%, and with cowpea, 31.9%. Now, I told you earlier that about 432 household members were tested for malaria over an 8-month period during the farming season from the month of May to month of December. And based on that, about 358 episodes of malaria were documented. And we looked at the results showing us that malaria was observed more in children, 55%, followed by a male adult, 25%, and a female adult, 20%. This has its consequences on man days available for farm activities. Malaria affected at least 3/4 of the households, and malaria have both direct and indirect effects. When the children are ill, it have effect on their mothers and even on the concentration of the household heads vis-a-vis their farming activities. And when the male adult or the female adult is ill, it also affects their level of participation on their farm and thus reducing their productivity. Now, for the purpose of this study, malaria households were categorized into two based on the proportion of malaria among household members. So we categorize malaria household into proportions. Those who have proportion less than 0.2 were categorized as low malaria incident households, and those that had proportion greater than 0.2 were categorized as high malaria incident household. And from this result, we can see that 86% were categorized of the household were categorized as high malaria infected households, while only 14% were categorized as low malaria infected households. And then we went further to look at crop productivity and malaria morbidity. And the result shows here that low malaria infected households were more productive for all the crops except for sorghum, probably because less labor is required for. Thank you. Okay, probably because less labor is required for sorghum production. Now we also compare the output level of high malaria incident household and low malaria incident households. The finding revealed that output was higher for low malaria infected households by 25% compared to high malaria incident households. Further results showed that there was a significant difference at 5%, implying high variability in the level of output. We also looked at welfare loss among malaria-infected households, and the result shows that household heads who are educated and use mosquito net had decreased odds of malaria infection by 13% and 22% respectively, compared to households who are not educated and who do not use mosquito net. We looked at the welfare loss infected households, and we find out welfare loss is the cost of medical expenses and the imputed cost of day loss. And the welfare loss is very huge, about 148,888 naira, which is approximately $409 US. We tried to look at the determinant of welfare loss, and all the variables fitted were significant at 1%. Adjusted household size and malaria incident had positive coefficient, and they were the determinant of malaria infection in the households. They were the major determinants. We equally measured, we look at protective measures used to reduce malaria in the household, and we find out that there are protective measures ranging from use of mosquito coil to use of homemade medicinal herbs. The use of homemade medicinal herbs and clearing of bush environments were actually often used in the study area. Now, the takeaway from this study is basically that malaria was actually tested and it was not inferential. And also, we discovered high incidence of malaria among farming households, especially among children. Significant variables associated with malaria incidents were identified. The result shows that high malaria-infected households are more productive than low malaria-infected households. The result shows that low malaria-infected households were more productive than high malaria-infected households. The use of control measures impacted greatly on the variability in the level of outputs, and there is need of creating awareness on the use of insecticide-treated mosquito nets and targeting the area for free net distribution and training on utilization would reduce malaria incidents and increase crop productivity. Thank you for listening.